Hello, Slaven. How are you today?
Hello, Simon. I'm very fine, thank you.
Can you tell me a little bit about yourself?
Well, I'm a medical student at the University of Zagreb School of Medicine. I'm also a very profound neurosurgery enthusiast. I'm involved in many neurosurgical societies, and I would just add that I am currently the leader of the student chapter of the Neurosurgical TV, a great organization that provides education to masses via the internet.
Thank you very
So
much.
thank you very much for having me.
Thank you. Today, I would just like to ask you a few questions regarding the M1 complex. Is that okay? All right,
Yes,
thank you.
absolutely.
My first question is, what is the M1 complex?
Well, that's a very nice question. The M1 complex is actually the M1 or motor 1. So it has something to do with the motor movement, the movement of the body. And this is because in this M1 area of the cerebral cortex, and that is the surface of our brains, are localized, all the neurons that are primary in every movement that our body makes.
I
So
see.
this makes it very important. These neurons are also known in neurology as the upper motor neurons, or the most important neurons that you can find in the human body when movement is discussed.
I see. Thank you. And how can you localize this area? How can you find the M1 complex?
Yes, as I mentioned, this M1 or motor 1 complex or area of the cerebral cortex or the surface of the brain is localized on the surface of the brain in a gyrus. So as you know, there are lots of gyruses on the surface of the brain, and they are demarcated by sulci. So if we consider the top part of our cerebral hemisphere, we can see one central sulcus which divides the two halves of the surface of the hemisphere. This is called the central sulcus. And just in front and in the back of this central sulcus, we can find two gyri. The one in front of it, in front of this central sulcus, is called the precentral gyrus. And this is the seat of the M1 or motor 1 area. On the anterior side, it is demarcated by the precentral sulcus, which is also an important area. So you have just a bulge on the cerebral cortex in front of the central sulcus that divides it into two halves
I
on the
see.
hemisphere. And this is called precentral gyrus or M1 motor area.
Thank you. And my final question is for any neurosurgery enthusiast, clinically, why would it be important to know this? How could this knowledge be applied?
Yes, well, it is very important because this is one of the most essential and most common anatomical landmarks on the cerebral hemisphere. So usually, if we consider neurosurgical operations, you very seldom have the entire hemisphere at your view. So you have to orient yourself according to these very small bits of tissue and landmarks on the cerebral cortex. And this strip of gray matter, as I mentioned, the M1 area, is one of the most common landmarks on the cerebral hemisphere to orient ourselves during the operations where we are. So it is I think, the most essential and most important area of the brain as well as the landmark point in neurosurgical operations.
I see. Thank you very much, Slavin. Please enjoy the rest of your day.
Thank you, Simon, as well. Thank
Thank
you.
you.